So a very pleasant good afternoon, everyone. Hello. So hold on. I see a whole lot of peeps online, but nobody responding to my greeting. So is that their mic?
Hello, Miss Waffle.
They're logged in. I just wondering if you're doing like the high schoolers, log on and then go find something else to do.
On my way, driving right now.
All right. So we are coming to a close where health promotion one is concerned. Who notice? Just a few more classes to go. And today we want to spend some time look at a Caribbean Charter for Health Promotion and the fact that it would have given birth to Caribbean Wellness Day, one of those features that we have on our yearly calendar here in Jamaica and maybe elsewhere in the Caribbean, not just Jamaica alone. So the objective that we really want to achieve at the end of this session is that you should be able to explain the rationale behind the development of this charter, to explain the tenets of the charter, and to apply it to principles in planning health education, health promotion programs. Now, if you go online, you can find a copy of the charter, and that's where you should be able to find it. But you can simply type in Caribbean Charter for Health Promotion and the information will come up. You can actually download or print a copy of it. So it is available online. And the charter did not emerge in isolation. It was born out of some specific issues. They had to look at the whole list of health, social and developmental concerns that were facing Caribbean nations, especially in the late 1980s and the early 1990s. What were the concerns that they had? There were some major concerns that were there. There was a rising issue of communicable diseases. So they were having issue with the burden, increasing the burden of communicable diseases. And by the early 90s, what was happening was that Caribbean countries were seeing a shift from infectious diseases to chronic diseases. So you're talking about increasing the number of cases for diabetes, hypertension, heart disease, etc. And we also remember that also on that agenda was the old business of the HIV/AIDS, which is now classified as a chronic disease, but at that point in time, it was deemed a infectious disease. These conditions were linked to lifestyle factors. We talk about the poor diet, the tobacco use, the alcohol consumption, and physical inactivity. Because technologies were advancing at this point in time, right? So we talk about physical inactivity. People my age were very happy that now you have a polisher to use and you didn't have to get the coconut brush to clean your floor anymore. Yes, because we grew up on the coconut brush. For those who live in Jamaica and grew up in the country areas, it was coconut brush and red oak and genie polish that was running the road in those days. But you guys are young, have no idea what those things look like. Yes, and so we grow up on those. So when it comes to the whole business of the advancement in technology and the availability of some of these gadgets, we were very happy to have them. What we did not look at was the flip side of what was going to happen. So we're no longer having to be going to the river wherever with our pan to wash our clothes. We now have washing machines. So you have all of those things happening. We didn't have to go to get wood to make a wood fire to do our cooking. We have our gas stove and our electric stove and all of those things. So we have been advancing over the period and the advancement is okay. But what we found was that there was not really a balance. So people were now becoming inactive. When we were young, we were the remote control for the television. So for those of us who had money for the children, we call and you tell them to go, no matter where they are, you are sitting in front of the television and you call little youngsters when they come. Yes, mama, go change the channel. So we were the remote control for our older folks. But as we get older, you find that you have to get up from where you are to do anything. If you buy a fan now, there's a remote control. You press a button. So you do, everything has changed. And so we find that there was physical inactivity. And that was one of the reasons why we have a sedentary lifestyle that would have given birth to some of the things that we actually are seeing happening now. Tobacco use, that would have increased over time. And we know alcohol consumption, that was always on the agenda. But they are now, all of these issues we realize require behavioral and environmental interventions and not just clinical care. So we want to move away from the medical model and move into the one that allows for the behavior change that we want to see, so that with more health promotion and prevention care rather than curative care. The existing health systems were treatment oriented and they were not designed for prevention or health promotion. They are sick, they come to you, you fix them, and you send them back. I think that is Trump. Another concern that was there is that the health inequities and social determinants of health. Because what we were seeing was that there was economic disparities, poverty abound, and there was limited access to education and employment opportunities where those were major determinants of poor health. And that is, when we look at education, yes, they had access to primary education and basic school education, but when it comes to tertiary level education in those eras, there was a serious urban drift because all the major universities were located in the urban center. So persons from the rural communities, if they want to access higher education, they actually have to move into the urban city. What happens is that when they come and they were through with their courses, they didn't bother to go back to the rural communities. And the truth be told is that they had no employment opportunities there, having completed their education. And so because of that, you have issues where there was the urbanization and the increase in the population in urban centers, while there was a decrease in the rural centers. And those were the reasons for it. Many rural and low-income communities lack supportive environments that allowed for healthy choices. So you talk about things like safe housing, you talk about clean water, you talk about healthy food. But when I look at that concern in terms of healthy food, I want to believe that those who were living in the rural communities, they might not have access to a lot of money, but I think they were more healthy in terms of their consumption. Because at that point in time, we never had so many fast food outlets a part of those rural communities. So it was eat what you grow and grow what you eat. So I think they were in a better position. So I am not so sure on what led them to say that healthy food was an issue for persons who were living in those rural and low-income communities. They were animals. So you have they rear chicken and they had their goats and their cows. So they had protein, they grow their vegetables, and the starch was here. They have a nice three-mix meal. So I'm not so sure why it was not considered as healthy food, because I think for me, they had a more healthy intake than those who were in the urban center. Those in the urban center now were more gravitating towards the fast foods. And I want to say that obesity is a offshoot of opulence, because it's those who can afford to buy the junk food that you find that most times end up being unhealthy or obese.
No, but junk food is cheaper than the healthy food. So
usually the junk food tend to be cheaper, and there's a deliberate reason why it is done, because you want to hook the people, and so you make sure that option is cheaper for them. There was a growing awareness that health promotion must address social, economic, and cultural conditions and not just the individual behavior. And that will take you right back to the whole list of the social determinants of health. There was limited public participation and community empowerment. But we sit down in our offices, we look at the epi data, and we decide what should be done, and we plan our programs, and we carry it out, and we drop it in the people them lap, and expect everybody to take it and run with it. So health planning in the region was largely a top-down, with ministries of health driving decisions and not communities, and communities were expected to be passive participants. The need arose to build partnership with communities and non-governmental organizations, the media, as well as the private sector. And I can recall many years ago in this top-down approach, I would have gone into one community and the community never had latrines or toilets. And the parachuting was taking place. And those of us who are Jamaican should know what parachuting is, right? Joe, do you know what it is? Joe is looking at me like totally lost.
From sky? The second class.
Huh?
Jumping from sky?
She's asking parachuting is jumping from sky. Somebody want to increase your knowledge base for me, please?
You use a scandal bag, you poop, and you whoop whoop sail it away.
Yeah, so you learned something today, Jody. All right, so parachuting in that particular community was the order of the day. The government decided that they would put in some communal toilets. But when they were the decision was made, it was not in collaboration with the people. They never had that partnership, that discussion. The decision was just taken from above that since this is happening, we need to do something about it. So we are going to put in some, because you cannot give each individual a water closet. It really was not feasible in terms of costing and all of that. And so they build the communal things and the people have never used it. When the investigation was done, people, their privacy. No, you're trying to figure it out because they put the bag and wheel it and toss it somewhere. Yet they didn't want to use the communal bathroom because as far as they're concerned, they have no privacy because everybody's going to see every time they're going to use the bathroom. So
where was this communal bathroom place?
It was communal because we were not in a position to give every single individual facility.
So it was like in a community center
any.
or like it was like a central location where people had to walk to go to it, to use the restroom?
Well, one would serve like three households. And so they were expected to take care of it and all of that. And so they were not happy about it and it did not serve the purpose for which it was intended. And so even when you're talking about the fact that we see poverty and we see people as being poor and they need these things, but we still need to talk to them because we can't make assumption in terms of what is it that they would want. There was another community when we go there with that same idea, the people were not up for it. They want their individual facility. The unfortunate thing in that particular other community was that their water table was extremely high. And so putting in water closet was a challenge, was a problem, because they're going to be needing some very specialized type of facility because the water table was so high. So even when you're talking about going in to help the community, despite what is happening, then you have to think about the plan with the people for the people. That's the best way I can put it. Because they are the ones who are going to be using the facility, work with them. So even with the disaster that we have now, I hope that they are working with the people because though they are in a certain position and condition, we still need to find out from them what is it that they would like. Rather than us just thinking about something and said, this is what you have, take it or leave it. It really does not work. So there need to be partnership, not only with the communities, but with other agencies and organizations as we look at involving the community in what is happening. The Ottawa Charter, which we would have gone through already.
Is the director for the Health Promotion and Protection branch for the ministry. I'm assuming she would be at the table when they're coming up with their solutions to suggest this. Because I realize that we'll always talk about community involvement, but it doesn't really, trickle down to them.
And I hope so too, my dear. I really hope so too, that they would have remembered that we planned with the people, for the people, and not just come up with something because of the statistics or the data that is in front of us. We would have gone to the Ottawa Charter and that would have looked at the whole business of the empowerment, but in the Caribbean, this had to mean a real community ownership due to small island context and resource limitation. So we have to recognize that although we have the Ottawa Charter that would have set that foundation, we also need to put it within the context of the individual Caribbean countries because it could not be a one hat that fit everybody. There was also weak intersectoral collaboration, and sometimes we talk about collaboration, but we don't practice it. Health ministries often worked in isolation, and they don't just work in isolation from other ministries and organizations. Sometimes even within the Ministry of Health itself, the different branches, the different units work in isolation. And if you want to know the extent of that, you be out there and you're somebody who need to be at various workshops, and you get 3 or 4 memos for a workshop, all of them scheduled for the same day. So you give an idea the extent to which even within the ministry, that collaborative effort was not there. And so while many health determinants lay outside the health sector, because some of them has to do with what is happening in education, what is happening in agriculture, housing, labor, as well as the environment, there was not that close working relationship during that period. It has improved significantly now, but we still have not completely closed that gap. Policymakers recognized that there was a need for a health in all policies, and that approach looks at integrating health concerns into other sectors. So even now, with the disaster that we are dealing with, they have to be looking at what is happening within the education sector, the agricultural sector, housing, and they have to be working together to see how best they can fulfill the needs that the community members have at this time. There was also the influence of the global health promotion momentum, and that would have started with the Ottawa Charter in 1986 and the subsequent Adelaide and Sundsvall 1988-1991, and those conferences inspired regions to adopt the health promotion approach to their local realities, and Caribbean leaders recognized that they too needed to have a regional identity and a framework and not simply to adopt the foreign models. Because what happens or what can obtain in Canada may not obtain here in Jamaica, it may not obtain in Barbados, in Antigua, because we have different nuances. And when you look at the countries, you have to look at the resources, you have to look at a whole lot of things, the kind of skill set and the capacities that they have to carry through with it. So we have to make it regional and country specific. Economic context and the need for sustainable development was also a part of that concern, because many Caribbean nations were facing economic austerity and structural adjustment policies. And for those of us who were old enough during the 1980s, when we had structural adjustment, when we had to borrow from IMF, and they dictated the kind of social amenities that countries could actually put in place. You're borrowing our money, we are going to dictate the terms. So who paid the piper was actually calling the tune. And we had situations where there were sectors that had vacancies that they could not fill. No, I'm serious. I was in education then, just graduated from Teachers College, and I could not get a job. And I remember one principal saying to me that we have the vacancies, but we cannot fill them because of the austerity measures that we were actually going through during that period. So IMF was dictating to them that they can't do certain things. It was during that period that Teachers College was actually closed. And the students from that college, some were sent to Paisley Gardens Agricultural College, and some were sent to Sam Sharp Teachers College. So because of those economic austerity measures, we recognized that we were in trouble. So the health budgets were limited, and the region needed cost-effective, sustainable health approaches that could mobilize community and intersectoral resources. So if government will not provide the resources that are needed to do the things, we must with our other NGOs to see how we can work to get to have a better and a more helpful nation. And as if all of those things were not bad enough, There was the whole business of the cultural and communication challenges, where Caribbean societies, we know that we are all culturally rich, but we are also very diverse. But health messages often fail because they ignore this culture, the beliefs, and even the very language. So even when they put out like brochure and leaflet, it might have languages that the very basic person at the bottom cannot read it. So I always say that when you're developing literature, any information communication material, if it is not target audience specific, like you are doing this for a group of doctors, or you are doing this for a group of nurses, if it is going for the general population, aim for the lowest reader within that population. If the lowest reader can understand the information, then everybody else will understand the information. But sometimes we say that, oh, if I do use this language, those who are up at the top are going to feel offended. Let them be offended. The important thing is that they still understand the information, but those who are at the grassroots, you need to reach them as well. So we have to think about some of those things when we are developing material. We need to look at our target population. There was also a recognition that the media, music, and community culture could be powerful tools for promoting health. I want us to look at that a little bit. In what ways does the media, the music, and the community culture really can be used as a powerful tool for promoting or hindering health? It can serve a dual purpose.
It's music always is catchy and it sticks with you, remember it. So when I talk music or certain, you remember it, and whenever you hear that thing, it's like you sing it to your brain. It helps with the memory.
And as a cultural people in the Caribbean, we love our dancehall artists and we follow them wherever they are. And that is why the HIV program will get a leak. When Beanie Man put out this song that you need to have gal in a bungle. Anybody remember that one? When say young, come on, man.
Yes, I know.
Eh? Gal in a bungle?
Yes,
Gal
miss.
from Rima, gal from Jungle.
Yes,
And
miss.
if you want a banana peel,
Oh.
you get a girl from Donna Maxfield. Come on, guys. So some of those songs are still available and they're on YouTube, and so you can really go and listen to some of them. And so the program got a hit during that time, because while we were there promoting the One Faithful Uninfected Partner, he was saying to his, talking about the community culture and who they look up to. And he come up with that song, and trust me, the song started to take wave. And so we complain about, how could you do this in the middle of this? And then all other dancehall artists came up with another song, Rude Boy, don't be silly, put a condom on your willy. And so so you have to pay attention to all of these things. And music is catchy, as I said, people listen to them. And sometimes the person that you want to reach, you have to reach them through some of those artists. But it depends on what message you're sending. Because could use so we can use some of the artists if we talk about One Faithful Uninfected Partner, because everybody in the community knows that whole girl them have. So you cannot use them because they would not have been credible source for your campaign. The media is very pervasive. It is in everybody's home. And right now, what we have in everybody's face is the social media platforms. Everywhere you turn, everybody has them, and persons are on several of these platforms. So you have to pay attention to what is happening within the community and how you can utilize them to your benefit. So they can be powerful tools for promoting health. I remember we were having a I think it was Breastfeeding Week program. No, it was World Health Day program. And we were in Old Harbor. And Barry G was having an outdoor broadcast that same day. So when we went down there, we realized that he was in the community having that thing. So quick o'clock, we put a few messages and pass them on to him. Him hear that on the program, it was a bomb. So we have to utilize what is available to get things going. So this is the Ottawa Charter of 1986, and we went through that. It was what, last week? Or the last class? Yeah, we did Ottawa Charter. I'm sure we had gone through that one already. So these are the tenets of that charter. And 7 years after the Ottawa Charter, we had the Caribbean Charter for Health Promotion. And this was developed or came into being when they had the first Caribbean conference on the 1st of June, to the 4th, 1993. It was held in Port of Spain, Trinidad, and in attendance were 125 individuals from health and other disciplines. So you notice it was not just from health, but other disciplines were there, talking about that multidisciplinary approach. And it was the first Caribbean conference that was held for health promotion. And so at this conference, they recognized that they had to go back to look at what was happening with the Ottawa Charter, and they decided they were going to build upon this global health promotion platform by tailoring health promotion strategy to the Caribbean context. And it was the Pan American Health Organization that funded that particular conference. And so when we look at the scope and the purpose of this charter, the charter aims to guide Caribbean states as well as communities and other sectors in implementing health promotion action that respond to the region-specific and developmental needs and agenda. And there are 6 actions that were taken. And if you look, these are similar to what they would have had on the Ottawa Charter. Is just that for the Caribbean Charter, they would have added the media as part of that portfolio. So you are formulating healthy public policy. You would have seen that in Ottawa. The reorienting of health services, it is in Ottawa. Empowering communities to achieve well-being, creating supportive environments, developing and increasing people's personal health skills, and building alliances with special emphasis on the media. So the Caribbean Charter added that component that you would not have seen in the Ottawa Charter. And these are the things that they had to say. For the reorienting of the health services, they look at making programs more responsive to the needs of communities and target audiences, and look at involving the stakeholders in the assessment and planning process. So here you're talking about planning with the people, for the people. And when we look at something as important as building a healthcare facility, often they employ an architect who come in and make some grand drawings and decide what is going to go where. But they have never worked a day in health. They have no idea what needs to be where it ought to be. So if you don't have somebody who have the understanding of the layout or what the layout should be for a health facility, then you'll find the health facility is built, and when it is handed over to health, then it is not appropriate for the kind of services that they need to offer. And right here in Southeast, I remember they had done a refurbishing of a health center out there in St. Thomas, and it was a disaster. They are still using it, but the layout is not how it should be, and they did not involve the health staff who work in that facility as a part of the discussion process when they were looking at drafting the upgrading plans. So we have some of those things taking place. So priorities was also placed on equality. Decision was driven by research, and there was a strengthening within the leadership. At the formulating of the healthy policy area, they looked at making health an important component of general development plans. I would have spoken already about the 2030 agenda and the other ones for the other Caribbean countries. This was out of that these things were also crafted. Multidisciplinary involvement in policy development, as well as application at the community level. With regards to the empowerment of communities, they look at the fact that we need to build social skills, for example, improve people's competency to do advocacy on their own behalf, and increase health literacy and training for both health providers as well as recipients. So if we look at the breastfeeding initiative, baby-friendly hospital initiative, we don't just train the staff who work there. We also, that means the health staff. And we're talking here now about the nurse and the doctors and the patient care assistant. We also train right down to the security guard. So although the security guard is not doing patient care, you have to remember that when the patients come for care, they do have conversations. And so when everybody within that facility knows about this baby-friendly initiative, a mother comes in and might come in with a bottle, the security guard can say, no man, remember the baby need to be given the breast milk and they can share with them the benefits. So we don't just train the clinical staff, we'll train everybody within the facilities so that everybody speak with a common voice. Because you're talking about reaching the target audience, which are the mothers who are doing the delivery. And if we want them to do this exclusive breastfeeding for those first 6 completed months of life. And so we do that training for them. When we talk about the development of the health skills, we want education for personal health using a variety of methods. And we talk about it being participatory, involve them. Using a life course approach for continuity and relevance. Emphasis was placed on general education and making programs applicable in various settings. We talk about the settings approach to health promotion, and we talk about the life course approach. We are going to be looking at Caribbean Wellness Day, which I take on this particular aspect, to use the life course approach in the development of what they do for Caribbean Wellness Day. But having said all of that, if there's not a supportive environment, then it is going to be very difficult to achieve them. So all aspects of environment should be considered, physically, socially, economically, political. And you might wonder why political. Remember, when you look at things that are happening on the ground and the need for you to develop policies that can be passed into law, then you cannot do it without the political arm, because they are the ones with responsibility for doing that. And so when we look at the whole business of the tobacco legislation, and I'm hoping to get one of the person who was very instrumental in his development to be here to talk about that with the class, you find that, and he had to go to Parliament, just up in the world, that 9 yards, to sell the thing to the parliamentarians. So you want to think that this is about people's health. And we are seeing the impact of the tobacco smoking and all of that. So it should have been easy cheese. No, it was not. We cannot get things done without the political arm, especially if we want to make it into law. So the creative, supportive environment needs to be there to support what needs to be done. We need to be able to make it easy for selection of healthy choices and behaviors. And we have like the Heart Foundation of Jamaica in partnership with other organization pushing for the front of label packaging, and other Caribbean countries have logged on, they have taken it on. Jamaica is not yet there. So if you see front of labeling packaging on anything that you go into supermarket to buy, look at which country it's coming from. It's not necessarily a Jamaican product. Because when Jamaica was supposed to sign that document, even though they had given their commitment, on the day of signing, Jamaica did not sign. And Heart Foundation is biting the government neck and telling exactly where the blockade came. It was political interference. So we have some of those that we do. Health and social services, they need to be accessible, acceptable, and appropriate. And as you do your primary health care, you'll add the other 2 to make it the 5 A's to primary health care. Building alliances, look at shared responsibility for health. Because we recognize that health is the whole business of health. It cannot be handled solely by the Ministry of Health. We need partners, we need collaborators, we have to work with the wider society. So we look at the whole business of a shared responsibility for health. And so that required a coordinated effort. And the media had a key role with regards to advocacy, influence, and communication. If you can't get the media on board, then you have and we can look at what happened with COVID-19 and the whole role of the media with those timely information that was being shared, and not just timely information, but I want to put in quote accurate information. And I put it in quote because it was accurate based on what we were getting from WHO and CDC. Granted, every Monday morning the information changed, but for the time when it was going up, it was accurate, and we need to have them on board. I remember when there was the whole business of the threat of Ebola, and I think we're having a dengue outbreak in Jamaica at a time. There was something else happening in Jamaica at a time when the Ebola thing was in the air. And the media wanted some information on Ebola, The Minister of Health was not forthcoming because the truth of the matter is that although we're making preparation should in case it comes to Jamaica, we did not see it as a thing at that time. So you find us that some of the media houses were going online and whatever information they find, they were just pushing it out there. The population also wanted information, so much so that a man went and did a big banner about Ebola and string it up somewhere along halfway road, and they quickly had to go and have it taken down from there. So but the thing is that the Ministry of Health as a speakers bureau that should have been activated when these things are happening, and that speakers bureau really determine who is the voice of the Ministry of Health to speak to media houses and give them information. So even though we as health education officer would have been on the ground working, when our media house come and push a microphone in our face, we have to redirect them. And you have to understand that media houses love sensation and they can twist what you say. So you might have given them a perspective, like you have say that 25% of the persons have been given vaccine. When they are going to report that, it's a flip side you're going to hear. This is happening, and 75% of the population is yet to have access to one. So it will have given the impression that was all you share the information with them. So we have to be very, very careful when it comes to talking with the media because they love sensation and they will twist and turn to get the kind of hype that they want out there. So looking at this from in a tabular form, almost like a summary, the concerns in the 1980s to the 1990s in the Caribbean, and what was the response in 1993 coming out of the Caribbean Charter for Health Promotion. So we saw where there were rising cases of NCDs and lifestyle diseases. The charter would say that we need to do some reorientation of our health services and focus on prevention and health literacy. Health inequalities and social determinants. Let us look at how we can create a supportive environment and address some of the socio-economic issues or causes. When we look at a limited community participation, let us change gear. Let us empower our communities to take ownership of their own health initiatives. Weak intersectoral coordination. Let us look at building alliances and partnership across sectors. Lack of regional identity in health promotion. Let us look at developing a Caribbean-specific charter that will do some adoption of the global principles. Where economic constraints were concerned, we want to promote cost-effective, community-driven health promotion. And where there was ineffective health communication, let us engage the media and our cultural channels for sustained health promotion. So that was how the charter responded to all of these concerns that were coming in the 1980s. So while the Ottawa Charter laid a global framework, the Caribbean Charter adds regional relevance by including an explicit emphasis on the media and alliances, reflecting the Caribbean's particular socio-cultural and resource context. So let us do something that fit within our context. And so the Charter remains a foundation reference for health promotion policies and programs across the Caribbean countries. It emphasizes intersectoral action and the need for non-health sectors to talk about making sure involve sectors like the environment, the education, the media, to engage in health promoting effort. It prioritizes community empowerment because the evidence would have shown that many Caribbean health promotion initiatives aim to build local capacity rather than simple deliver services where we need to go. And so we need to include the community in terms of what we were doing. What are the implications and how applicable is it? In planning a health promotion intervention, we need to address for example, to address non-communicable diseases, mental health, or youth health. And I want to say that in recent times, I would have said before, I noticed that there has been a trust to look at the mental health of the population, because I recognize that we have to look at a broader definition of health. And so persons may not have any signs and symptoms of any chronic disease, but mental health issues, and would have seen where in recent times would have had a number of issues with the whole business of suicide, murder, suicide, and sometimes just plain suicide. Practitioners in the region would reference the charter to align their work with regional priorities. They talk about strengthening public policy, creating supportive environments, and we talk about, we look at settings like schools, workplaces, as well as communities. And of course, we want to do some work in building people's health skills. For monitoring and evaluation, the 6 strategic areas can serve as domains to assess whether programs are aligned with the Charter's intent. And so countries often adopt the Charter's principles into their national policies. What are some examples of national policies? And I was looking at some of those that are specific to Jamaica. St. Vincent, you need to look at what is happening in your country with regards to this. So one of the policies that would have looked at national policy is the old business of promoting healthy lifestyles. And the national policy for the promotion of healthy lifestyle aimed at the reduction for risk of non-communicable diseases, cervical cancer, HIV, AIDS, and decreased violence and injury. So you'd have seen coming out of Ministry of Health, all of those policies. Right now, the NCDs are on the table where they are looking at know your numbers. That's a part of the NCD. They would have done a lot of training with corporate Jamaica. We're looking at workplace wellness. They had the Jamaica Moves program. So all of those things are focused on the NCDs. Cervical cancer, we're talking about the vaccine program that they had tried to implement for the 7th graders in high schools, and the HIV/AIDS program, which was mostly externally funded. They had a whole history of the amount of work that they would have done with regards to that program. Also coming out of the Ministry of Health was the violence prevention program. So all of those things were aimed at promoting healthy lifestyle. Then we had the Vision 2030, which was a strategic plan. It was a multi-sectoral, multidisciplinary involvement in its development. It emphasizes tackling the social factors that influence health outcomes, such as where people are born, where they live, and where they work. So again, you know, see the health promotion settings approach coming out even in that, the way that vision was crafted. We had the food-based dietary guidelines in Jamaica, which was launched to help prevent NCDs by guiding the public toward healthy food choices and physical activity. And again, we also, those are still out there. And Jamaica would have changed their the pyramid, the food-based pyramid, and in a plate. Because when we look at it, we recognize that the pyramid was not cutting it. When you're going to be eating, is a plate you have in front of us. And in those days, plates were not coming like rectangle and triangle and or something. They were just really round. And so we would have used that now to give persons a visual idea of the amount from which food group that needs to be on that plate if they're going to be having a healthy diet. I understand that America is now shifting from that pyramid and looking towards adopting that plate, because they recognize that give a better visual picture. When persons look at it, they know that the meat must be that little bit versus this versus that. So they have a visual feel of what is happening. So we see, oh, when you start and look at things and try to make it country specific and region specific, there's a foundation that is there. You can use it as a platform, but you have to do some modification to fit your particular population. We look at workplace and school initiatives. And so we talk about a corporate wellness challenges, which is a national workplace initiative. I know that was a biggie. I don't know to the extent to which it is still a biggie that is on the workplace agenda. And we have a Jamaica Moves program, which uses social media to promote healthy habits, not just in school, but in the population on a whole. And it's a long time I haven't seen an initiative coming out of the Ministry of Health that really impact the nation the way that particular one did. It really made an impact. You see more people now walking around with their water bottle. I hope it is not just for show and they're actually drinking the water, because sometimes we like things for status symbol, you know, but we're not necessarily using it for what it is intended for. So I actually hope that they're drinking the water. And you see a whole lot more persons walking with their lunch. It's like lunch bag is an in thing now, and they come in all size, shape, and description, and everybody is proud to walk with their lunch bag. Let's hope what they have in the lunch bag is a balanced meal that was properly prepared. And I'm saying properly prepared because if you're still having the fried chicken and the rice and the whatever, like, well, it's not a, it's what I'm saying. So let's hope that them walking with the lunch bag with their meal is a healthy option that is in there. If they prepare it like the way the restaurants outside prepare it, then they might not be achieving the objectives for which they are walking with that. Some critical considerations. Although it was adopted in 1993, some of the structural issues in it address NCD's health equity, intersectoral partnership. These remain persistent within the Caribbean. Implementation varies widely across countries given differences in resources, capacity, and governance. So it depends on what the political directorate really see as being important. It also depends on how much funding and other resources are available and the capacity of the persons to actually carry through with what they need to carry through. So while the charter provides a strategic framework, local adaptation, context-sensitive design, and evaluation were seen as key areas for consideration. The charter emphasizes empowerment and participation, and interventions must avoid being top-down and should instead engage communities as active partners. So in summary, the Caribbean Charter for Health Promotion was born out of a recognition that health is created and lived by people within the settings of their everyday life, where they learn, where they work, where they play, and where they love. And that in the Caribbean, this requires community participation, cultural relevance, and across-sectoral collaboration. And so, how did they actionize the Caribbean Charter for Health Promotion? We want to look at one era in particular, and that is the genesis of the Caribbean Wellness Day. This was a Caribbean-wide government initiative mandated by the CARICOM heads of government because they would have met and they had their discussion, and this was one of the things that came out of that discussion. And it was fostered by the regional institutions like PAHO, WHO, and it is celebrated the second Saturday in September of every year. And their overall slogan is "Love That Body Through the Life Courses." The inaugural celebration was in 2008. And it was structured to use public, private, and civil society partnership to strengthen collaboration and advance the Caribbean Wellness Campaign. The goal is to stimulate ongoing physical activity in communities, workplaces, and schools, and to promote healthy food choices and screening in a smoke-free environment. This experience is unique in that it is multi-country, multi-sectoral, and is designed as a catalyst for a sustained health promotion activity in these countries. So annually, the event is geared at increasing awareness and promoting activities to address the epidemic of NCDs. And so they would have had teams over the year, raising international, regional, and national awareness, preventing NCDs through the life course. So in 2008, the slogan that they used was "Love That Body, Treat That Body Right." In 2009, they focused on the adults. So in 2009, they were having the inauguration, the first time it was being done. But remember, it is geared towards the life courses. So in 2009, they started to pay attention to the life courses. And so the adults were targeted healthy lifestyle in the workplaces. So the workplace was the focus for the activities for that particular year. In 2010, you had Move for Health. And so you had the whole of the Jamaica moves coming out and getting highlight out of this. In 2011, they really did not focus again on a particular age cohort. They talk about love life, stay healthy, and live long. So I'm not so sure why they started out with the adult and then they would have shift gears for those 2 years. But in 2012, they recognized that they were not really going according to the mandate. And so they went back to looking at the life courses and they decided that they were going to start with the younger population. They were starting with the children. And so it was building the foundation for building healthy lifestyle. And so the setting that most of the activities were done during that year was in the schools. In 2013, they look at the youths 15 to 19 years, and the slogan was safeguarding the health of our youth for a brighter future. Again, the setting would have taken place in mostly high schools because that's where you find most of these children within that age cohort. 2014, they went back to looking at the adults, preserving the workforce for national and regional development. So again, you know, they target persons who were in the workplaces. 2015, they went for persons in my age group, improving the quality of life of the region's aging population. 2016, they went back to the children, so you notice it's life course now. The cyclical life course activity started. Healthy children in healthy environment, 2017, the youth, a brighter future for our youth, 2018, adults preserving the workforce, and 2019, healthy aging. In 2020, though, the overall theme was changed following consultation with key partners with a view to include the society as a whole. So even though they started out with this life cycle, drop a little bit, pick up back, they decided that they were no longer going to be using that same life cycle approach. So their new overall theme for Caribbean Wellness Day now is Power Through Collective Action, and the sub-theme for 2020 was Stronger Together. In 2021, it was In It Together, Building Healthy Communities, and of course, the emphasis would have been how can we help the persons to stay healthy, because you notice we were in the COVID period at this time. So you notice even the flyer had persons who were wearing their mask. In 2022, we're still in COVID, so a mask was still in our neighborhood, our health, re-imaging healthy spaces, active society, smoke-free Caribbean, and healthy schools. So that's where their focus was in 2022 for Caribbean Wellness Day. In 2023, Power Through Collective Action was their focus. And you know, some of the partners who are there, you have the CARICOM, you have CARFO, Pan American Health Organization, and you have Healthy Coalition for the Caribbean, which is a Caribbean-wide organization. September 2024, our health is our right. So they have several. So for 2024, that was the slogan, our health is our right, and the focus there was on healthy eating. So you notice what that flyer was looking like. They are saying yes to fruits. They are saying yes, well, mostly fruits that were on that side, melon, banana, and mango down the bottom, and they were saying that persons don't need to say no to things like the donut and the burger and the cupcake and all of those things. But we have a sweet tooth, so I'm not so sure who they are going to get persons to drop that one. In 2025, which is the year that we are now in, the focus was on collaboration and intersectoral action to address NCDs like heart disease, cancer, and diabetes. And the key element that they looked at was My Caribbean Plate, a tool promoting healthy eating and cultural heritage. And this first layer here said, our traditional foods are rich in nutrients. You grow it, you know what's in it. So they were actually making the appeal, going back to the whole business of eating what you grow and growing what you eat. And these were some of the flags that they had. So one was what's the Caribbean plate? Said my Caribbean plate equal balance, tradition, and wellness. And here they were talking about different things that you can have there. So staples, get your energy from ground provisions like your breadfruit, your sweet potato, rice, corn, or pasta, and say choose from options. And they look at some options. And when those were the options, and they were saying that persons need to make a choice from that. And a quarter of what is on your plate need to come from that particular group. The other one was say that a quarter of foods from animals, legumes, and nuts. So they were giving up persons one idea when they are preparing their meal, how their plate should look in terms of the portion that is there. And they tell them what those foods are for, to build muscle and strength. And so the ones that help to build your muscle and strength is your beans and your peas, your lentils, your fish, your chicken and lean meats. And so they are saying that this is what you can actually choose from when you're putting on your plate. And the amount that should be on your plate is a quarter of what is on your plate. Then they look at traditional home cooking, so it is healthy cooking. Choose local, eat fresh. So they were advising people to stop buying the imported foods. But with Melissa, I don't know if we have no choice. Yeah.
Yeah, because the minister said that he's gonna bring them in.
Well, I don't think he has a choice.
The only restaurant open.
I don't think.
The cook shops lock.
Yeah.
At the island, I think the rainforest started, when we went on Tuesday, rainforest started carrying food from Kingston to Mobile to be sold.
Yes.
All the other restaurants are closed, only
But
KFC.
I wouldn't even buy food in the West because they don't have water.
Come on, KFC are different business. KFC make sure that they have them tank, that they have generator, and they have them own generators.
Yes, I was told by
KFC,
as a manager at KFC that when they were building that particular KFC factory.
The KFC is across from the hospital. It opened when we went there, not this Saturday before. The KFC was open.
So the day
When
after,
we were
the day after the hurricane, the wind.
Why would it be across of the hospital?
Because when the people, when you're by the hospital and you're waiting long and you're hungry, the hospital don't have a canteen, so you go across the road, go by the, no,
Even the decision to approve it to be right there.
no. A business person is very strategic in where they locate their business.
We have to government to be strategic too.
But if you get for the long line, the hospital, so hungry.
Yeah, but give them the option, it just force them hand, that other day, like them put up, I think at the health center where I work, vending machine. And when you're looking, they contact, they coordinate with the nutrition center, the health education officer before they put in these things in the vending machine.
No, but even some of our health facilities, when they do have vending machines, is no healthy food in the vending machine.
I was waiting on you to finish this particular lecture because my question is, the Caribbean Charter for Health Promotion, do they work with RADA or any of the agricultural sector? Why I ask is, this is being pushed as to how we should eat and the proper way to eat, but access to such foods is a challenge in our country. So who sits on this committee or program?
And we have had that discussion already about the access, the fact that we tell people that this is what they need to do, but we did not stop to think and look at affordability and the availability. Because we're telling people to eat 5 servings of fruit and vegetables every day. But healthy food is extremely expensive. How many persons can afford the healthy food? And right now, with the food basket of our country flat, we are now going to be seeing, if we are not careful, an escalation in obesity, because right now it's a belly full running it.
And that's exactly what they're gonna take, a belly full.
Because they're just keeping life and bread together.
But do they have a committee, Miss?
Well, it was 125 persons, and they said it was across sectoral. I don't know what the agenda looked like in terms of what agencies or organization were represented at that particular meeting.
Well, the good thing is, no, the minister said that rather gonna give them free seats, where people and the other part of it to start replanting and give them free seats for the different stuff. So we'll see.
I don't know, I think I prefer agriculture. I saw more widespread in terms of integration of farm to table. I could see where each parish and the parish rather extension officers were working. There were more access to free trees, free fruit trees, free seedlings, tools and stuff like that. The whole backyard garden, it got me interested to have that little backyard at home. And you could actually go to the RADA office and get seeds and tools to start your backyard garden. Even in your apartments, persons in apartments, there were extension RADA officers who went to apartments showing how you could do like hydroponics on your wall and on the veranda. So I loved when he was Minister of Agriculture because it directly saw farm to table.
Because he's a marketer. So that's his role. He's a marketer. So like we know need to use the marketing
You know,
skills.
we had a minister.
He's a marketer, that's his different
To eat well, and I can't.
If you're going to finance, you would think we have more money now. I'm just saying. He's a marketer.
So you're talking about skill set, and you're talking about capacity. I think one of the thing that happens is that they are both in the same party. Therefore means that you wonder about the handing over. I do not know what happened, so I'm just wondering. I'm not saying it did not happen, because I don't know. And then if I'm taking on a particular portfolio, I would spend time to look at what was done, what worked, and what did not work. What can I build on? What do I need to introduce? So all of those things are part and parcel of when they are given portfolios. Those are things that they actually need to do. So, there was a time I remember when I'm trying to remember what event it used to be when RADA would actually come with a lot of seedlings. So they come to those events and you could get seedlings from them to actually go home and plant. What we used to do too is when we are doing our health promotion activities, especially for chronic disease program, would have worked with them. So I know St. Thomas does, and I know Kingston used to work with them too, where they come to those events and you have discussion with the chronic disease patients about how they can prepare balanced meal with what is available to them, show them how to prepare some of those meals so that it is actually healthy. So I know that there was that partnership. I don't know the extent to which it is still being done because I've not been on the ground.
Forks and shovels and seedlings to make the seedlings and other stuff to go plant.
That's in St. Thomas?
Yeah.
Okay. But I know that there's a good working relationship with RADA and the nutrition team in St. Thomas and their promotion team. And whenever they're having events, they are usually a part of. And RADA would also prepare things and take it to the events.
Even
So-
for knowing numbers events, we have events.
But usually you have to write to them to ask.
Yes, you're right. You have to write to them and ask because they would have to give an account to their organization in terms of their outreach that they are doing. So it's a matter of getting back to that partnership and collaboration.
And that was like 3 years ago.
Yeah, we have to get back to the partnership and the collaboration, especially now. Because so many more households may now start to think that I need to start doing a little thing in my backyard, even my cash vegetables, cash crops, because I was always depending on others to plant and I go and buy. But right, so it's a matter of how we market what needs to be done. Now is the perfect time
I think so.
for government to stress the backyard gardening. Very perfect time to do it. But will they capitalize on the opportunity? I know when we had COVID,
But them just come out and say what them are doing these things.
yeah, but we understand the need to do importation because you can't leave your population starving. So we understand the need. We just hope it is not going to become a long term because it was recognized. It was recognized that Jamaica was spending a whole lot of money on food imports. And I know successive governments would have really stressed the importance of eating what you grow and growing what you eat. That concept started with Michael Manley. That concept started with Michael Manley.
Yeah.
It was from then that concept started.
Yeah.
But we kick our foot and we stamp our foot and we want with cornflakes from foreign. We did it's not local cornflakes we want now. We want with cornflakes from abroad and all of those things. Even when Ministry of Health would have partnered with Ministry of Education and look at the reduction in the amount of sugar in the beverage that children were getting, parents were pushing back at it because the little chubby cost them less than to buy a fruit juice or to make the fruit juice at home. So even when we look at if they are pushing back, we also have to look at the reason for the pushing back. So we see all of these things happen. So it's not black and white. There are a whole lot of gray areas in between the black and the white. So we are back to this traditional home cooking thing, and we need to really start looking at doing some backyard gardening. And some persons are doing it, and it is doing very well. I mean, right now the backyard in some pots.
Yep.
You see some pop throw. They're big and fresh and healthy. You see tomatoes.
That's the internet helps. So my mother really show what she do too. You say no, she'll collect eggshells. Apparently, you can crush it with the eggshells.
Apparently.
I never know that. I see her doing all these things in the backyard as a stand gun. She run Garo on there. Well, look what blow down and so. It's St. Catherine.
You didn't do
But we never do that.
4-H club at primary school?
No, not all schools have 4-H club.
We never do that. I'm not gonna say
We never had 4-H at all.
Okay, thanks for that.
No, serious, not all schools have 4-H clubs. Even now, not all schools have 4-H clubs.
And your sticks, your little sticks, bamboo sticks, or your chip sticks, and your eggshells, you put them
I
on.
never do that too.
And it work well for flowering plants too. Yeah. So we need to engage to empower and to elevate, and we also want to share with persons as part of what they did for 2025, that in preparing their meats, they should choose to do bake rather than or roast instead of fried. And some of them will tell that the children only want fried chicken. I'm saying that what you give them when you are weaning them from breast milk to solid food is what is going to set the pace for their palate. So it's what we do at that particular point in time. Online, anybody want to make a comment? Hello?
They don't push that part for a minute here. That way. So I don't want to say no. Apart those 6 months, sorry. Yes, the weaning 6 months, as in how you, what they
No, they tell them all the time. The people
Because it
just
push
go there.
more.
No,
No.
you tell them.
It a show. And the TV just.
We have a TV.
No,
TV and then play baby shark, baby shark.
I have a TV.
And send them out. They could have played the song.
There is a TV in Exeter. But
Always.
there is no remote. There is no play. So it appeared no 5 years now, and no, I tried, because I literally went and searched. The TV is so rare that you can't find a remote to turn it. Everybody bring their universal remote and try to use it. I don't know whether to get that TV. So we need a whole new TV.
But as people say, are you more DVD on the remote?
We have videos, the videos, I have in section 3, but walk and beg all through the ministry. But they don't have any videos on that, no. But on the public nurses is that they do the talk. So even though they don't have it on a screen, they always talk.
I'm just saying, but sometimes they're not paying attention, but as they sit and it plays, it helps.
And I'm going to ask the question, what is the message do we give them? Is it that we tell them the weaning is that the children should now start eating from the family pot and not paying attention to how the family pot is prepared?
That's true too.
So that is something we have to pay attention to. Because eating from a family pot is fine, but how was the family pot prepared? Because if it's junk food, they're going to be eating out of them family pot. Is that the picnic going to get?
And Friday daytime, a KFC, so the family pot.
So we have to look at it from that perspective as well. What is in the family pot that they are being introduced to? So we have some of those things, but I do recall that 40 televisions were purchased and distributed across the region. And the intention was for it to be used as a source of playing health-related messages. Flash drives were, several messages were loaded on the flash drive because those were smart televisions and they were supposed to be played in the health facility. A year and a half after those were sent out, I did an audit of what was happening on the ground. Yeah, because you're doing something, you need to evaluate what is going on, right?
Right.
One facility that I went to, I was told that, yes, man, the TV play every morning. Who has responsibility for no. So I went into the HE room and I was having a little discussion. Miss, Bunny broke from when and I can't play. Yet I was given other information. Some facilities would tell me that the patients don't want to hear any health message, they want to watch Cushy. You might remember that Korean soap?
My mother made my love cushions.
Yes. So the feedback was that the health staff was not using it.
They were pressured.
Look here.
They were pressured.
When you go into a restaurant,
You have to work.
exactly.
Then wait. So what I will usually do is that I play, but 2 minutes they need to know when cash what I play. We start with it.
No, that is not me.
You have to be reasonable. But they come to clinic to watch TV.
That feels really good. That
It's about the
I guess
hour
we-
videos. So if I play for 2 hours and the patient then says to me,
It's a
"Boy,
no."
but why is when the cash pot I play?
Yeah,
Cash pot I 10 minutes.
It's a no.
We can't stop it 10 minutes and see your pot then do the cash pot.
Yeah.
But no, I have to make sure the message is played at least twice, and then when they ask me, for example, what was the event happening? World, yeah, those kinds of things. And everybody wants to watch
That's true, that's true.
Yeah, let's start with regular patient and get you to tell
That
you
is
crazy.
true.
I always want to fight me.
Alright,
I'm not going to stop it for the whole day.
Yeah.
You have to be strategic in how you.
And you manage.
That's
And I would beat her up for that because you have to take their in, because remember you're working with them, you know. And you see, if you don't give them that 10 minutes to listen to them catch plan, they don't hear nothing at all on the TV, they then turn off this.
Yeah, that's
Are
true.
they go?
Or then plug their ears with their headphone or something. So we have to work with them. But the feedback was not so very, very heartening when I did that audit afterwards in terms of what was happening. In some areas, they were not working and that information did not filter up. And so we didn't know what was going on the ground. And so as
on the project, somebody have to own it. That's what I find.
in Northeast,
Responsible for the
Yeah.
start.
yes, the facilities were asked to identify a person who had responsibility to do that. That was a part of the discussion with the facilities. I know in the Northeast region, they did also try to have that in place, but in that region, they had a central location from where all the messages on the TV were played. So you can have it, just like cable. It's one place all the cable coming from.
Oh, I understand.
Right, so they had a central location from where all the messages were being played. So within the facility, they had no direct control, so to speak, in terms of how and what messages were being played on the television. So in that regard, the patient couldn't ask the cushion and the catch flat because the staff at the facility would have had no control, it was centralized. So it's a matter of being strategic. It is the extent to which you have the resources to do what needs to be done. And I often say that when the allocation comes, if all the regions get $400, Sierra should have gotten 8 or 12, because Sierra has 47% of Jamaica's population. All the major facilities are in Sierra, so Sierra need to be getting more out of that budget to really manage what needs to be done. So the other region would have had access to more resources that they can use to put certain things in place. So the equity is not there. So we're talking about equity in health, but even in terms of the allocation for the operation of our health facilities, I don't know that there is equity. So even when we look at the ideal and what needs to happen, we also have to look at the reality of what is available and what is there. So how do we get things to be at the place where we want it to be?
I realize, for example, we have a lot of computers in our IT. We've got these computers for over a year now, with no plans, no connectivity to actually use them, no access to labs, nothing. So some of the computers already get hit up, and because we had a small desk when we put a computer on it and we do not use it. So we have less space for our pile of dockets. So as you can imagine, sometimes the record will come around, grab the docket and hit it into the computer.
That's how when they came to Humphrey and they wanted to take up my good computer, I told them, said, listen, no, man, we don't know what the pattern on that. One, we did find one next place to put it, but I keep my computer before we say work, but we can't do the work. Because it's 2 years ago, they're bringing
And then the ones with the same
not being able to do any of the work, I used to go on my computer. Because I was so giddy about wasting a new computer. So special. Something in my mind said.
No, it's paid for the whole electronic thing, so they're paying it though, but in a reach yet, so.
So they just buy it up and put it there.
And put it there, but
And of
nothing,
course,
same thing in center.
And then they say we cannot move it because that's its location and it's already in your records that it's so many computers.
Expired, they have to use it, so they won't buy it.
That's true, but it's true.
If you gave them the money was about to expire, so they needed to use it, so they buy all of the computers with no plan or no money.
The internet not set up yet, the internet not set up yet for it to, listen.
And so it comes back to equity, and sometimes we have the resources, but the planning in terms of the utilization of the resources was left outside while the resources were being shepherded on the inside. Because I do know that there are some health facilities that still don't have any internet connectivity. So if they don't have internet connectivity, how are you going to digitize anything that is there? So we have some of those challenges and some of those issues, and you wonder, let me move on. Another point was working together to improve health and well-being for all persons. They look at supporting local, what is being done local. So they say buy your local produce. Visit your local farmers market for fresh fruits and vegetables. We do have our local markets, but sometimes when you go in there, what you think are fresh, something is still imported stuff from foreign, you know. You realize that most of the onions that you get in the market are not locally grown onions? Yeah, of course, you know, the locally grown onion looks different. We need to carry along a cargo show you different. Yeah, you see onion and you buy onion.
More round like a apple or orange.
Yeah,
And it doesn't really shape.
And it tends to be whiter. It doesn't have that brown cover. Our local onion, the imported one is brown. The local one tends to look like whitish.
White.
Yes.
Oh. Yeah.
Not easily.
Okay, that's true. I didn't see them.
So most of the onions that we buy in the market, they're not locally grown. You look at your carrots too, you can tell the ones that are locally grown versus the ones. the foreign capital, all of those things. And then for them to get those products from there to here, something must be done to them to preserve them.
Spray them.
Yep.
So we have to think about those things. So even when you say to buy at our local market, we also have to be mindful of the fact that not everything that we get in our local market are locally grown products. We don't grow grape and we don't grow up. You know, there's somebody in Jamaica is now growing.
The apple you told us. the one
Yes,
that's
from Africa, right. I hope I can find that place. No, experimenting with it. And it was a long journey for that person. Because the first couple of years they lost just about everything that they invested in it. Yes, but they did not give up. Your health is your choice. It's your right to have healthy options. And you notice the gentleman standing there looking at the shelf? It is right to have healthy options, but what are your options available? Read the nutritional facts on labels to make healthier choices. And you notice her face? Look like she don't understand a thing on the label.
Not even me sometimes understand.
I know that another thing I do is they convert the kilocalories. So they can,
I don't have a clue what that means. I am being totally honest.
it's more than calories. So 100 calories versus 100 kilocalories. So
They are not the same thing.
no, because the kilocalories is more.
Oh,
So you see the number 100, I think, oh, you good, but it's like 100,000.
oh Jesus.
So
Ouch.
It's not easy. I don't know how the mother is easy. but it's
Counting
not
calories
easy.
is the worst way to try.
They have some simple sheets that you can use now where they tell you the amount of calories like in a slice of bread. So if you look at a slice of white bread and a slice of brown bread, it's the same amount of calories in them. The only difference is that the one with the wheat in it will allow for a better bowel movement than the other one. For those persons who are online, you are awfully quiet. Hello? Hello. Hi.
We're here, miss. We're here.
We're here.
Yeah, but you're quiet and not hearing anything from your Chris. Oh, you're quiet, so.
I'm tired.
But stop it.
Same thing you say.
So what if I'd walk in here this afternoon and said, boy, I'm tired, I can't bother.
No, we don't understand. It's
No, I'm here. I'm listening. I just don't have anything
Yeah,
much
but
to
when I'm
say.
hearing your involvement in the discussion, you're not sharing your 2 cents. I don't even hear Danai, who is one of our big nutritionists.
Good afternoon. Sorry for joining late.
Better late than never, my dear. Oh, the nice called school today. Oh,
do their observation maybe.
the nice called school. All right. Nourish your body with my Caribbean plate. And this one is geared for the children. Telling that carbs give them energy to keep them moving throughout the day. The protein build and repair their muscles. The vitamins and minerals protect against disease and infections. Healthy fats give them hormone balance and healthy body cells. And water brings hydration and flushing out waste. I think the language kind of heavy. Like seriously?
for kids.
Yes, I think the language is kind of heavy because when we look at this material that they put out, we can also critique it. And for me, I think that thing is kind of heavy.
They should say the glow foods, the glow foods.
Yes. What foods make you grow? What makes you glow? What makes you go? And they understand that concept a little better. But we're
Well,
telling
it
them
depends
about
on the
carbs and
target
protein.
age group.
Pardon me?
What is the target age group for this poster?
If you look at it, there's some little babies missing on it. So this look to me like basic school children or primary school.
Preschool and in grade 1.
Right.
They have an idea of the glow and the glow already.
Right.
Yeah,
That
they're
cannot
supposed
capture
to
their
know these
attention. And
things.
Hear them.
what was that, Chris?
They're supposed to know this, as in my daughters know it. One is 9 and one is 4.
That's it, it's on the curriculum, that's what they learn.
Why them a kill it, them a primary school, by the time they reach high school, they tired of school.
Only Caribbean.
Imagine how tired you are.
Only, that's why I was so tired. Only Caribbean pop you up so.
You know, in Canada, children don't get homework before they are 13 years old. I am serious. 12 or 13, they don't get homework.
I have a friend who her child is in Germany, they live in Germany, and she killing up herself. One teacher picnic catch math at home because all them do interactive play and solve the problem.
I'm serious. And they do very well in universities. But we are killing, we are killing our
We
children.
need to stop this conversation about how the Jamaican education system is the best, because when our Jamaican children go overseas, they top the class and they top everything and they win all the prizes.
They don't need all of this pressure to stop the classes.
Exactly, and not only that, we need to be reminded that oftentimes we want to go overseas, they don't want to.
No, miss. You know some people when people high school people they roll on the box. Could never in front. You're frightened
When they move overseas,
you're trying to go.
Oh, me too.
Because our standard of education is much higher than over there.
I kind of learned it because even I was having a conversation with a math teacher who used to teach high school in Jamaica and who teaches high school mathematicians. And the level required for our children in terms of.
It's about 2 grades above theirs.
But everything is not black and white. We need to also remember that even within one state, there are different class and there are different requirements. So you can have two high schools within the same district and they have different requirements and testing systems.
And different curriculum.
Yes, because it's based. So oftentimes when someone will say to me, when I was teaching at Campion, and no, I am teaching in South Carolina, the testing system is lower than what I'm accustomed to at Campion. It's all based on, because America does their education system, it's based on number. It's based as well as their labeling. So what type of students are in the class? Are they mainly minority? Are they mainly upper middle class? Are they mainly white? Are there mainly students who are going to move on to trade school? Are they going to move on to university? Are they going to move on to college? Because out here we have university for everything. But over there, their system is different. They have certification. Certification gives you more money than a degree. We kill up ourselves out here for a master's. A master's out here for them is like a associate degree. Because what they recognize is certification. So it could even be, that's one of the reasons persons are moving out of the teaching profession in America. So a lot of Americans, they do not really want to be teachers because you have to go through this process of re-licensing, re-certification. So it's not only having the degree, you can be a fire person, any profession in America, and still be a teacher. You don't need to go to a teacher's college in America to be a teacher. Because what recognizes someone in America to be tenured is the licensing and the certification.
And the skill set that they come to the table
That
with.
determines the type of school where you teach as well. So you can be teaching in New York, but you're not licensed
To teach.
in Florida.
Well, I know that every state has their own licensing body for all the professional areas.
Exactly.
Every state has their own licensing body.
Sometimes let's be careful when we do comparison because it's not straight black and white in America versus straight.
But I still maintain that we are killing our children at that lower level.
Yeah.
We are killing. A lot of things that they do at that level was what I did in high school. And I don't think I'm any worse off of doing it at high school rather than at primary school.
What's the difference between the average Jamaican child and the average child from a developed country? And I say developed country deliberately because even with my own son, when he was at a particular age and his cousins, and when they come to visit, so my son would be academically smarter, but in terms of self-expression and confidence and delivery, it's vast
Difference.
So they may not be able to explain photosynthesis, but they can say, oh, but the tree, the sun is shining on the tree. Why is
So the analytical skills are well developed.
Exactly, and we all know that to get ahead in life is not necessarily being book right, but you have to be able to analyze, identify, observe, and then explain. Yes.
So I like the conversation, and I wish those online would join us in the conversation, but they're just so very quiet. Yeah. Your vegetable plate, they show you the type of vegetables that you can have. But we also have to be mindful that even though it is healthy, persons also still have some other conditions that may hinder them having certain things, and that has to be given consideration as well. I find more and more these days that persons are going to the doctor and they are being told to drop tomato from their diet.
Oh, yeah.
They cause a kind of particular pain and what have you.
Especially persons who have gastric ulcers.
Yes,
It's called
yes,
trouble.
yes.
And onions, yeah.
Yes.
Tomato and onions could cause worsening.
Yeah, if that's stomach issues, and enough Jamaicans are with that stomach
Not so much.
Okay, I was just kind of wondering what was going on, why.
Like hot pepper. So hot pepper, acidity. So
Yeah.
they have fruits and vegetables that are very high.
I had okay.
Yeah.
And their stomach already, if they have H. pylori, or they already have peptic ulcer, the acidity is already high.
Yeah.
And they
Okay.
get bad stomach pain, and then it could affect them tolerating other things that, and even affect medication absorption.
Okay, thanks for the explanation, because I was really wondering what was going on. Because I noticed that tomato was coming up very often in that. So all right, so no,
It's all Crystal, Arabic and no English.
that's not Jamaican spelling, miss. No, that's not, no, that's not how we spell it here, but it.
Okay.
That's actually the.
But it's a Caribbean thing.
What, that spelling?
Yeah, it's spelling.
So just remember, look at the agencies that are a part of it. So it was not, but we understand what it is. Even though for us it is not spelled correctly, we know exactly what they are talking about.
Okay.
All right. And of course, we look at the whole business of the eating habits and the food that we ought to be eating. And then we did not leave out the exercise part of it.
And this year they did the 3K to start off the Caribbean wellness.
So it is healthy eating and exercise. I remember the focus is on the NCDs, and those are the things that they are promoting to help with that. And I think we're finished with the class for today. And I had this little picture for a long time. And I saw it and I thought about what is happening right now, what we are going through as a country. Now, this was in Nashville or Asheville, North Carolina. And it was on October the 5th, 2024. And it's almost a little over a year later that we have suffered devastation here in Jamaica. To the magnitude that still have people crying. I stopped looking at the stuff them on the social media now.
Yeah.
But what was remarkable is that despite everything, there was bloom. The rose was blooming in the middle of that devastation. And for me, that's a signal of hope that while things are bad, we can still pick up the pieces, and that even in the midst of the devastation, we can find something to be positive about. So for those of us who have relatives who would have suffered, some of you might work for the area, come up for school, and you were boarding in Kingston, you might not have any house to go back to because of what has happened. Take heart. Even in the midst of all of this, we can find something to be happy about. You have life, and as long as there's life, there is hope. And sometimes some things are taken from us to give us something better. And I say that because I remember 2023, the 14th of November, when I had that accident. The car was a total write-off. And I walked out of that accident without a scratch. Not even a scratch on the car, was a total write-off. I had something better now, right? So sometimes something happen, it provides the opportunity for you to do something that you probably wanted to do. Because I really wanted to change the vehicle, like seriously. The painting started shipping, and when I was looking at the price, I was like, God, them price are too high. I mean, I have that kind of money here right now because I have a mother to take care of, and all of those things. Like, you were just finding all of the reasons why you could not. But when you turn over and write off, you had to. So even though some person might have lost everything, or family members would have lost everything, see it as the means to rebuild and rebuild better. As long as there's life, there is hope. So even in the midst of that, we can find something to be happy about. This one says we don't grow when things are easy. We grow when we face challenges. We don't grow when things are easy. We grow when we have challenges. It's how we navigate the negative things sometimes that helps us to mature and grow. And the wise old owl said, no matter what yesterday was like, birds always start the new day with a song. Birds are always chirping. So see Melissa pass through, if Melissa never blow them to somewhere else, you hear them chirping the following morning, right?
Yeah.
They always start the day with a song, no matter what happened the day before. And so sometimes we can just take the time out to not focus so much on the negative. It's bad. It's a reality. You have to deal with it. But can we just refocus our minds? And we can make it through to the other day. And those are my few words for today. Did I go over time?
You're right, fully.
You have time left?
Okay.
You have 5 minutes
We have
for
a
QR.
We have some concerns about the
About the what?
QR.
Yes.
We have a lot of things.
It's QR, not QR. There's no
We are
quality in that.
All right. I am going to have to try and touch base again with Prof. Uchi, because I recognize the challenges that you are having, and they are real. So I'll try and touch base with Professor Uchi. The challenge that I know I'm having is looking at your timetable, is how to find a space. So that's how we are having a problem, because normally for the group presentation, there are what, 8 groups? And we can't do the presentation without a triple session. There was only 1 triple session that came on the timetable. Because with so many groups presenting, everybody cannot present what they need to present within a 1 hour or even a 2 session. They need more time. You have done the hard work, you need to be given time to share what you would have done and prepared. So I'll talk to Prof. I have absolutely no idea where we are going to move it to. It can move to January, but we're in January because the timetable, but of course it's left no on it.
Oh Lord, please move it to January, Miss, I swear.
Miss,
But we're in January when you have other courses on your timetable.
We would find something.
Huh?
I'm sure somebody could give us Miss.
Miss. Mrs. Walters.
Nothing for Christmas, we can't get the fun food.
Miss, someone is trying to say something. Someone online is trying to say something. It's not me, it's Janelle, is you?
Mrs. Walters, my query is on the observation aspect of it. We're the ones who are to make contact and seek permission, or we'll be getting like a letter or something from you.
Make contact, seek permission. If it is that they are requiring a letter, then you can let us know, we can have it prepared. But normally students usually make a contact and they have no problem doing what needs to be done. Because I try to make sure that even one person in the group is at the facility so that they can do that. So that was why I asked you where you live and where you were working. I was asking for that information for a reason. So that I could group persons to make sure that they are at facilities where even one person is there to broker that entry.
Okay, Miss, thank you.
But in the meantime, I suggest that you still try to do what you can, because I don't know if we are going to be able to do the shift. Based on how the timetables are set up. It's not like they have any free sessions on it that you can just utilize. Somebody is slotted for each session.
What is the asterisk on the December 3rd?
December 3rd?
The asterisk here, bypass asterisk.
No, it means that particular session. On the December 3rd is a Friday? Maybe if you say an asterisk, then it means that nobody's assigned. But I think, no, this is,
I remember.
I don't know. But that's the 7 to 9 session. And it's only one session.
But there's three.
What?
But there's three of them. Because you have the 3rd, the 4th, and the 5th.
You mean 3 7 to 9 session? So you would want to do your presentation in those sessions?
Oh, what about December then? January?
No, that's December. But would that, you have to do a poll to see whether, and I need to find out.
Are those teaching sessions, those, the December calendar updated?
Yes, that's the updated one that she's looking at. So those sessions nobody would have been assigned to those. The following week is the exams, and I also have to confer with Professor Uchi because I don't know if he's going to be doing teaching because this is not the only program that he teaches on. So I could not just take that decision here. I have to have that dialogue with him. And then the following week you all have 4 exams, right?
Yes, miss.
So I don't know. We're in a hard place.
Right now, me feel like me stink. I feel like I'm sinking.
Everybody on campus.
And then it's a very neighborhood.
Everybody doing the same thing on board.
But Minister has
was a different this one, as Mr. Lopez said, all the groups are assigned at least 1 or 2 persons are from that
Institution.
They can be.
Miss, for the school, we're going to need a letter.
Because if we scrap that observation, they would still have to get something else misplaced to do. So I'll talk to Prof. They might get a written paper to do if we are going to be dropping that.
No, miss.
what is the, when would you read the paper?
Well, I'd have to have discussion with him and then.
Would it be a take-home written paper that would bring up like AP? Or would it,
You know, it would be a take home,
it would be a take-home?
but I'd have to have that dialogue because it's a co-delivery. I don't make those decisions unilaterally. I have discussions with him. So.
Next we have that.
Huh?
What is our next class?
For what?
Today.
You know, the QR.
So what we do for that session today, because initially it was supposed to be the
So there's nothing assigned for that session because that session was given to you for you to do what you need to do.
Today, yes, there was no observation.
Yeah, but.
So we can have teaching.
I probably will just work on.
But miss,
Work on the,
that was a concern for me because, why did the university decide on a day that the observations must be done? Because after contacting the different facilities, they may not decide that, okay, this is the day that you can come.
No, but I explained to you that we made provision for that. It's up to you to decide when you're going to do it. But we do make provision.
But what if the facility says, for instance, this is the day that you can come and that day we actually have class?
What's recording?
You're not going no more. I did.
I had to assign a time on the timetable for 2 hours for you to go. I could not send in a slot because you have other classes. So I could not leave it open like that. But having assigned that time, then the group can make a decision when they are going to go to do it. It's not cut and dried that it must be done on the day when that time is assigned. Because you have some group who do their thing on a weekend or when they do it during their time. Right. Some persons groups might go in the morning and do what they need to do. But I have to make provision for you that at least there's a time space. But it doesn't mean you can't do it any other time. Okay? So I'll call Prof and have discussion with him. I don't know what is going to happen. And then I would need to get a poll from the class to see who would prefer to just go continue with what is as is. So I need that poll. Because I can't just do it like that without everybody being in agreement. But the PJ, who's in some more down there? All right, send me his contact information in terms of how the letter should be addressed and his email so it can be sent.
Yeah, because we're going in action, I'm going to have up to Friday to check, right? Which is already the 14th. So when I will submit the checklist, that initial date we have was the 20th. But now we also have to put in literature review. That he was saying he wanted a literature review, he wants what.
A little background information on the institution is basically what
Oh, it seems like you wanted background information on the institution and just a general thing on why what is important. Based on cases, he actually said use like 2 or 3 research papers to justify why it's important.
That's what you said last
So
time.
it became more, that is why I said January, because what he said last night sounded a lot more extensive than what I had in my mind. In my mind, I was going down to Jubilee with my little checklist.
Yeah.
I was kicking off and talking to people like this working, this working. Y'all do drills done, do up a presentation. That's what I thought initially. But then what he was saying last night was a lot more.
What is on the rubric?
It's like a really full qualitative research is what he wants. How he said it, right?
Qualitative specialist at what you're looking at.
He wants us to do recordings of when we talk to
And
people.
to take pictures.
And take pictures and all that. He said he wants pictures.
No, pictures are fine because normally students don't put pictures in their thing.
Recordings when we talk to the people. So that's why I was like.
Yeah, because to get those have to get people's consent and all of that, and when you write up time is that. I wonder if you did look at the time frame.
So that's why I was like, no, it doesn't sound like what I initially thought it was.
Da da dee, da da da.